Hello. I'll start by saying I'm Anna, and this is not my normal voice. I'm making this video because my speech therapist told me it would help to talk more and talk things out. The reason my voice is like this is because I had a recent heart surgery and my voice got damaged somehow. My vocal cord got bumped or something, but it's hopefully not a permanent thing, but I'm struggling with it a little bit. I'm trying to do the therapy every day. Twice a day you're supposed to do the exercises where if you've ever had to do speech therapy, it's kind of embarrassing to do, but you're, yelling out random phrases and sounds, or just trying to yell, because I can't get above a certain level anyways. This is my third heart surgery. I have what's called Marfan's. Maybe some of you out there know of it, or know someone, or have it. It's not very easy. I'm not typical looking for Marfan. I am not tall and not super thin, but I have it. It's not genetic. I didn't get it from any family member. I'm thinking it's a mutation. I don't know anybody in my family who has it. My recent surgery was to repair my aorta, and it went okay. This is my third time. Second one was on the side. First one was emergency. So the anesthesia is starting to wear on me a little bit. I don't know if you know what that's like, but anesthesia can be very harsh on your system. Not to mention the actual surgery, but yeah, it's something that it takes a while to get over, and it takes forever to get out of your system because it's harsh chemicals in your body. So I'm working on some detox methods. I'm trying my best to not have to take as many meds that I, want to. I'll take what I have to. Pretty much I always am permanently going to be taking Coumadin because I have a mechanical valve. So I can't take any other form of blood thinner. But it's been okay. Coumadin can be kind of crappy at times. It gives you headaches. It makes it hard for you to digest things sometimes. You can get colder easier. Just things that go along with your blood being thinner. But I've managed this far in life. My recent surgery, they did add a new scar for me. This one's on the side. That was to help oxygenate my blood flow or something. I'd have to go back and check. But for anyone out there who wants to, know anything, feel free to ask questions. This is basically me trying to exercise my voice, and so I'm going to talk about myself. And if you find that interesting, sure. Maybe I'm making this video just for me. But, it is what it is. And if you want to hear more, let me know. My voice is slowly getting better with the speech therapy. I think that's what people tell me. It's kind of hard for me to tell for some reason. I think it is getting better, but I don't know. For some reason, I can't really tell as much as other people can. They also suggested to sing out loud sometimes or to read out loud, so I'm trying that too. But this is why I'm making this video, because this is me using my voice. Marfan's is a heart disorder for many other people. I only have the heart issues, but some people have lung and I think kidney or liver. I'm not sure, but you can have your eyes start to dislocate. You can have bone issues, muscle issues. I think I do heal slower, but I have a very high pain threshold, which is good, especially with all the heart surgery. My first surgery was emergency about 10 years ago. I was 22. I was luckily at home in Atlanta, and my aorta split. And for a lot of people who don't know, that is a really scary thing that can happen to you. You can bleed out. You can die immediately. But lucky for me, I didn't know what was happening, but I knew something bad because I felt pain and I couldn't see. my vision went out. So they rushed me to the hospital, my parents did, and they didn't know what it was at first. They wanted to send me home because the hospital we were at was not the best in Atlanta. It was just the closest one. And they decided randomly last minute to do a CAT scan and said, oh, your aorta split. So we're sending you to Emory, which, thank the Lord, because Emory is one of the best hospitals, and I got one of the best surgeons probably in America. His name is Dr. Robert Guyton, and he saved my life. So that was, the good thing. It was really hard to get through that first surgery because my body was not prepared for it, and obviously it's when you go through any kind of trauma like that, you are, affected. It's what it is. So luckily I'm here today. They've been keeping an eye on my aorta because it does split in other areas. That's part of the Marfans. And so they'll go in and repair where it needs to be repaired and when it needs to be repaired, because it usually has to be a certain length before they go in. This third one is, I don't know if it's my last one. They said I have another tear towards my abdomen, but it's the last time they have to go in here, which is good news. Don't have to deal with scar tissue issues, because apparently it's harder to cut into you when you have scar tissue. What else? I'm an art history major. I didn't really do much with that. My health kind of deterred me throughout college. It was in the middle of college when I had my first surgery. And then by the time I graduated, the economy was not good. It was in 2009. So I ended up doing a lot of work here and there. I pet sit. I love animals, so that's one thing I know I can do with my health. And I love gems and rocks, so I tend to study those a lot. I have a 3-legged cat. She's pretty adorable. She's also kind of a jerk sometimes, but I love her. Yeah, I don't know what else to say at the moment, but this is my first attempt at exercising my voice and talking about things. I guess I can start with advice if you've ever have to go through heart surgery. My first advice would be prepared, have lots of family and friends nearby or on call, because it's a good feeling to have them around, even if they're just texting you. I didn't really want many people in the hospital this time around because I didn't feel very good. The anesthesia really affected me. I was having horrible nightmares, and I just didn't want anybody to come see me at the moment. Better now, but yeah, that's just how it was at the time. I know the first surgery I really did like people coming because I was really out of it, so I may not even remember half of them. But I would suggest looking into bralettes because, this one in particular is a good one. I got it from Macy's. It was like $20. You can get a cheaper one, but they really help, not having to wear a bra when you first get out, because it hurts. Your chest is hurting and you're all sore, and nobody wants to put a strappy, tight, wired thing on them. And if you're a bigger breasted woman, I would suggest maybe a bandeau for the first, couple weeks or month, if you would prefer that. Some women maybe don't care about the bras afterwards. I could not stand the idea of putting one on, so I did bralettes. And I may do them forever now. I don't know. They worked pretty well for me. Yeah, and lots of things to entertain yourself afterwards. I have a lot of Netflix that I'm watching, and I invested in those adult coloring books, which is fun. Something to do. I'm a crafter. I do a lot of arts and crafts, so I have a whole span of things to use here. And just talk to people, because you're going to be a little sad. It's part of the process. You're going to go through some depression. You're going to feel alone, and you're going to want support. Even if you don't feel like you do, you need it, because you're going to you're going to delve into some sad times. You're going to, you're just going to feel really down, and you're going to cry. It's just going to happen. Your emotions are wound up, and your body is traumatized, so that's going to happen. Comfortable pillows for nighttime. I like the body pillows, but I've heard even the maternity pillows work pretty well. They kind of wrap all the way around you at night, so you basically just sink into them. So if you can afford it, or you can find one, maternity pillow, I would suggest, or a neck pillow, because my neck was in pain after the surgery. I don't know what they did to me when I was out, but my neck hurt a lot. I know they did put a bunch of wires into my neck, so now I have these little vampire bites. They'll eventually go away, but it looks funny. It looks pretty funny. So yeah, be prepared for that. You might get some nausea. I had terrible nausea after this one. I didn't have it so much in the first two, but I couldn't eat much, and the pain meds just made me feel more nauseous. And I don't know if that was the surgery itself or the anesthesia, or I'm not sure, but it doesn't make it easy. Ginger tea helped, and Pepsid. I took a lot of Pepsid. I take more than the prescribed amount, but you'd have to ask your doctor about that. Yeah, just be prepared for just different things. It depends on the person, I know, but listen to your own bodies and understand that it's a process. You're going to take a while to heal. Don't let anyone rush you. There's a lot of people that like to ask, how long are you going to be out of commission, or how long are you going to be healing? And there's no real answer to that. There's no right answer. It's kind of like grieving. You're your own time frame. You know your own body. You know your own self. So don't let anyone make you feel bad if you take a little longer to heal. And with my voice the way it is, I'm taking a little longer to heal as well, so that kind of is a process too. And I can't really go out looking for jobs at the moment because I sound like I swallowed a balloon full of helium. Or some people say I sound like Marcel the seashell. I don't know. You can decide. But that's why I'm doing this video, because I want people to understand that it's tough. And, if you want to go on a site and find other people that have gone through it too, that helps a lot to talk. Just talk it out. I mean, that's why I'm doing this video too, is to talk it out and make myself feel a little less crappy, because it's not fun, it's not easy, but you need, to find outlets. So here I am. So again, if you need to know anything about my surgeries or surgery in general or my voice issues, I can talk about anything really. This is to help with boredom too, so feel free to message me or post questions. And if nobody ever sees this video, it's not a big deal to me either. It's just, it is what it is. So thank you for watching if you did, and I will maybe make more. Bye now.